Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
My name is Tola Adebanjo, and you're listening to the Pharmacy Leaders Podcast.
Welcome to the Pharmacy Leaders Podcast. My name is Tony Guerra, and I am your host here at Des Moines Area Community College in Ankeny, Iowa. Connect with me on Twitter at Tony_PharmD or on YouTube. I have 1,200 videos supporting my book, Memorizing Pharmacology, which are all free. So today we have a really special guest from last year, where we had kind of a little fun contest for APHA and just seeing what kind of social networks people had. Tola Adebanjo is a final year pharmacy student from the University of Maryland Eastern Shore. She's interested in pursuing a PGY1 pharmacy residency in a large academic teaching hospital. So welcome to the Pharmacy Leaders Podcast.
Thank you, Tony. Thanks for having me.
Now, you have, in a very short period of time, gone on the national pharmacy scene as a final year student. Students really would like to know, what is it that you've done in your leadership road to get from just starting pharmacy school to now where you're doing nationally recognized pharmacy rotations?
Well, let me answer that first by saying I know that there's not exactly one road, but I'll tell you a little bit about my experience. Just from really the first day at pharmacy school, I knew I was in a new place, I was in a new state, and for me, getting to know people and getting to make relationships is very important. So my first thing was, how can I do that? And just through involvement and realizing that there were a lot of organizations, I knew that I'd be able to start to meet people, start to get to know people. And from that, also have the opportunity to develop networks to start, leading on a bigger level or getting involved on a bigger level.
Okay, well, you went to the University of Maryland Eastern Shore, and Jim Brissett, who was faculty there, he was a classmate of mine back when we graduated in 97. So it's been about 20 years, and it's very exciting that we have some new pharmacy schools. And when I say new, that it's not really new anymore. But tell me a little bit about the 3-year program, how you like UMES, maybe what drew you to it. Because now, after 4 years, instead of having a pharmacy school graduation, hopefully you'll have a PGY1 graduation. And I think that's the direction we seem to be moving.
Yes. So 3-year program, a lot of people kind of gasp when you talk about that, but I've really enjoyed being at UMES. The thing that really drew me to pursuing a 3-year program was just the idea that I did have the undergrad experience, and then I did go into the working field. I was working as a chemist for about 2 years in between there. But for me, I knew that when I was going to pursue an education again, in higher education, I wanted to do that in a timely fashion, as well as the appeal of UMES when I went there. I wasn't sure if that was even possible, because I was like, that's a lot of schooling, that's a lot of information to learn in a short period of time. But what I found at UMES was the size. We've got about 60 people in a class, give or take, and the faculty, it was very one-on-one, very personal, and relationships are very important to me, as I'd said before. And so you mentioned Jim Brissett, and Jim Brissett actually was on the first day during our white coat ceremony. He had every student's name memorized, my name pronounced beautifully, memorized. And so it was one of those things where you just felt a strong relationship right off the bat, very much open door policy. They discussed that a lot, and it meant a lot to them. So I wanted to go somewhere I felt at home and didn't feel like another number. And that was just the environment where it matched for me.
So tell me a little bit about preparing for APPE rotation, something that really, I know, and I'm going to be saying 3rd year when it's not really the case for you guys, but a 3rd year in a traditional 4-year program very quickly has to figure out what rotations they want. And I feel like there's kind of an expectation that from the residency directors that you're going to have a certain rotation schedule that they're going to expect to see. So you've done a really good job of maybe combining exploratory as well as focused. How did you set up to choose your APPE rotations or your APPE rotations?
Oh, I appreciate you complimenting. I think each of those rotations was very unique, and I feel very lucky to have explored them. But so in our second year, the traditional program's third year, we were told and just explained they explained to us how the rotation lottery system would work as far as applying. And being on the Eastern Shore of Maryland, the number of opportunities there is limited. So it is important that you really take a hand in how your rotation schedule is going to be set up, especially if you know there are certain places or experiences that you want to get. If they're not offered maybe on the Eastern Shore, then it's necessary for you to kind of seek those out or maybe even create them on your own. So a few of the opportunities that I had were programs that were offered by application only. So a few of those I, just did as every other student who, has big goals and is excited for bigger experiences. I put through an application for those. And others I actually ended up setting up. So I knew I wanted to be able to spend a little bit of time back in the Midwest where I'm from. And so I did a little research, and based on what areas of my rotation kind of curriculum that I needed to fill, I was sure to kind of seek out opportunities in those areas and see who was willing to create kind of a new contract with the University of Maryland Eastern Shore in terms of having students come to complete a rotation there.
Yeah, when I talked to Dallas Tolbert from UMES, she was talking about not just being part of an organization, but creating organizations. And it sounds like now that we're seeing maybe some smaller classes in pharmacy schools that really that kind of entrepreneurial, if it's not there, it's not that I'm going to accept that it's not there. We'll create it. We'll set it up. We'll make it happen.
I agree.
Yeah. Well, tell me about Johns Hopkins. It's the Ivy League was, is its own kind of was a sports league, but there are what we call outside Ivies, Duke, Stanford, Hopkins, places like that. Johns Hopkins is one of the most sought after experiences in the country. Can you tell me a little bit about your first experience, which was at Johns Hopkins, and how it was a more extended experience? It wasn't just a single block anymore.
Yes. So I was very fortunate to have had the opportunity through my school. They did a great job of setting up a contract, I guess, with the Johns Hopkins Hospital in terms of having students complete what they call the clinical track rotation. And in that, I put out an application, the cover letter, letter of intent, those types of things, provided my resume or CV, and in addition, just kind of was able to really pour through what my passion and my drive to pursue this type of rotation experience was. And lucky enough, I was able to get it. And it was a 4-month experience, or 4 blocks. And ultimately I completed my acute care rotation there. I completed an ambulatory care rotation. I worked a little bit more on the administrative side, working with the managers in the pediatric department. And then my final rotation was more of an elective, and that was a critical care elective where I worked with the solid organ transplant team, more of the thoracic, so heart and lung transplant. And really the experience, it was a little intimidating because, like you said, it was my first set of rotations coming out of the didactic portion of the curriculum. But I think the amount of support you had when you were there was incredible. I ultimately, on my very first rotation, which was in acute care, I came in nervous. Did I learn enough? Were these tests enough to test my knowledge? But at the end of the day, I think from the experience, I was able to gain a lot as far as clinical decision making within the facility, being able to work with the different teams, work with the different physicians, and within the pharmacy department, there's just a lot of support there for students' growth, their learning, and just the teaching there was just incredible.
So the rule of thumb is never do acute care as your first rotation.
I wouldn't say that. I joke with my family and some of my friends, I almost felt like it was the sink or swim moment. It's like, you go in, some people try to plan their schedule. So it's like, okay, they ease into it, which honestly, I don't know if in pharmacy you're ever easing into anything.
Yeah.
All of these are very clinical based.
Yeah.
It's all very clinical based now. So I think really it was just a matter of you got to put your best, everything that you have forward and show this is what I know, and I'm willing to learn. If anything, just showing that you were open and willing to learn and seeking out those opportunities, I think that was something that helped me while I was there, as well as kind of showed that I was really driven and excited about the opportunity.
Can you tell me a little bit about each of them? And we'll go through each one at a time, because I feel like a lot of times you've got to kind of read the blurb on it, and that's where you get your information. But maybe we can give a little audio description of each one. Explain what an acute care rotation is and maybe what you do on a daily basis, and then AmCare, and we'll just go one at a time. But start with acute care. What's that like? You're there on the first day, and what's going on?
So in my acute care rotation, when I was at the Johns Hopkins Hospital, I was able to work with an amazing preceptor, and she ultimately had both a role. She was BCPS certified, and she had the role of working with an internal medicine team. So what we did was we had a team while we were there, and we would go on rounds with the team, and she served as like right then and there kind of making those critical decisions as far as what medication adjustments needed to be made, what new start type medications needed to be done. And then on top of that, she served kind of in a staffing role as well within the the adult inpatient pharmacy. And so she managed had a lot of hats that she wore. But every day we had a patient list anywhere from 10 to 15 patients. In the beginning of the rotation, of course, they try to ease you into it as far as, this is what we want you to focus on, whether it be disease state specific. But we were looking at patients with congestive heart failure, patients with diabetes, and they were more like the acute complications of those disease states and the necessary actions that need to be taken to take care of those patients.
Okay. And then acute care and AmCare tend to be the two hottest fields, I guess you would say, if you're talking about residencies. When I went to the ASHP meeting and went through that residency showcase, I did see a lot of attention to the AmCare and acute care. But tell me a little bit about what it means to be doing AmCare at Hopkins.
So when I was at the Johns Hopkins Hospital, I was able to work. This was actually kind of a newer, I don't know exactly how to describe the way that it was set up, but what they did have was I was doing oncology, and it was ambulatory oncology. And what it was, there were pharmacists who, again, they were BCPS certified, and they were individually assigned to certain types of cancers. So I specifically worked with a pharmacist who was working specifically with multiple myeloma. And so in that setting, I was able to visit with the pharmacist alongside the oncologist in the clinic setting. And so each day we would check the clinic schedule for that specific oncology or oncologist. And then we would go into the clinic and we would sit and see the patients. The pharmacist's role was to manage their oral chemotherapy agents as well as managing their overall treatment regimen. And so with these patients, we would talk about whether they were experiencing side effects from the medications. We would talk about, if they were no longer getting the wanted benefit from the medication, and we would start to explore other options alongside the physician. And furthermore, we were really just very much involved with their outpatient care as far as calling these patients on a weekly basis, seeing how their medication regimen was going, and if there were any issues and adjustments that need to be made, we were kind of that point of contact to then again go back to their specific oncologist and speak with them about what should be done to continue to help the patient.
Okay, I know one peds pharmacist down at Xavier in Louisiana, Joe La Rochelle, and he's very clinical, but the peds rotation you did, you said, was a little bit more of a managerial role. So there's certainly many, many aspects to any type of care for Pediatrics. Can you tell me a little bit about what it is to do an administrative or managerial elective?
Yes. And I will say this first and foremost, what I think I found most exciting about all of the rotation experiences I've had, and specific to the ones we're discussing now, is each of the preceptors did a great job of really just trying to identify what your passion as a student was and what you wanted to get out of the rotation. And while, I clearly want to pursue a role within a hospital setting and really be working alongside patients and a team with physicians, there's more to it than just that. And so when I was able to do this pediatric rotation, I got to continue in the clinical role where I was able to go in the ED, I was able to go into the NICU, and as well as explore pediatric oncology. But what I was doing during some other times within the rotation was attending important meetings, as far as whether it be formulary meetings, whether it be safety meetings, drug shortage meetings. I was able to sit in, and there were projects assigned with those meetings where I would be, whether I might have to, make a newsletter to inform the pediatric pharmacy what drug shortages are occurring, or I might have to present what the current drug shortages to within the actual meeting. So there were several opportunities where you were able to really facilitate the conversation, and you had to go do the research behind the scenes, and you would work alongside. There were two managers specifically that I worked with within the PEDS department, but again, I was working with multiple with the different divisions within the entire hospital.
And this next one I know a little bit about because I just heard an RX radio podcast on a solid organ transplant pharmacist and what he did. And I wanted to first find out from what does Hopkins do? Because I understand that some can just specialize in certain organs. For example, kidney tends to be one organ that, because there are two organs, because you can donate it, this tends to be one that we see quite a bit. But he said it was so satisfying to see someone that was having organ failure and just how they present physically. And then after the transplant to see how well they are doing. And then also that they're switching from one regimen of medications to a completely different regimen post-transplant. So can you walk me through what interested you in transplant and then what your experience was?
So I think the biggest interest is kind of exactly what you just discussed. Like, these patients, they're coming in and they're, some of them very, very much critically ill, or they've been waiting for an organ for quite a while. And for me, the thing that was so unique is in school, you get some these are more specialty areas. So you get some education as far as transplant is concerned, but you don't really get to see it firsthand and see all that goes, on behind the scenes. And so from the pharmacy perspective, when I was at Hopkins, I got to work specifically, as I'd said, with lung and heart transplant. And just as you had, spoken to, we had patients who came in and they were, not doing well. And after the transplant, within a week, they were going home, and you see them doing well. Their medications are working and they're feeling well. They're feeling great. They're thanking the team for, such a profound recovery. And then, there's also, unfortunately, the other situations where, this is where these pharmacists really come in hand, and the team plays a huge role in their care. And it's those patients who maybe after the transplant aren't doing well. Maybe there's rejection of the organ, or maybe their medications that they're using aren't, the anti-rejection meds aren't working as well as they should be. So there's a lot of adjusting, and there's a lot of monitoring of those drug concentrations, as well as the side effects from the medications that they're taking. So for me, it was really cool to see each day all the things that the pharmacists were monitoring. I felt like in this area, there were a lot of, not fires to be put out, but it was just a lot of things that were coming in as far as messages to the pharmacist or calls to the pharmacist about what level, did you see the level? What do I need to do? What adjustments should be made? And those types of things. So the pharmacists really have a huge role that they play in solid organ transplant.
Okay, so now from there, we're just going down I-95 for about half an hour But we are completely going to a different world, going to APHA. My wife actually did that rotation, I want to say like 8 or 9 years ago, because she wanted to be near me and I was living in Baltimore. And she helped set up for the APHA meeting. She was, I think, in March or April, somewhere around there. But tell me a little bit about APHA and how you get that rotation, first of all, then what you did at the rotation.
Yeah. So for me, going from the Johns Hopkins Hospital to APHA was almost a complete 180. I mean, I was using a lot of the same skills and completing some projects in the same in that same type of respect, but at the same time, I went from dealing with patients and physicians and pharmacists all day to more of an office type setting. And so for me, I was like, do I wear my white coat? What's going on? But no. The APhA Experiential Rotation was an amazing opportunity. I was able to obtain that rotation through, again, this was a national application process where through the website, they have the whole application. And I would strongly recommend it to any student who just wants to understand, especially if you were involved within pharmacy organizations. APHA has meant a lot to me as I've been a student. And so to see it kind of on the other side, not just within the student chapter of it, but from the pharmacist level, these practicing pharmacists, and to see what impact we're having on the national level, it was very amazing. But so each day at that rotation, I was working specifically with the practice side of things. So we were looking at new initiatives for different pharmacists within all practice settings. We wanted to know what types of continuing education that they needed. We wanted to know how we could make their membership more meaningful, whether, like I said, through CEs or through toolkits as far as ways that they could strengthen their practice and really show the meaning of what scope of practice pharmacists do have.
Okay. And then I thought that, going home was a really important thing. And although I lived in Baltimore during pharmacy school and my parents live in North Potomac, which is maybe 45 minutes, it can tend to be a world away. So I made sure to do one rotation where I lived actually with my grandparents. And if you're not from the DC area, we talk in metro stops. So my grandparents were by the White Flint Metro. So that was where I was at. And then APHA, that would have been down by Metro Center, is that right? Where is APH?
It's Foggy Bottom.
Foggy Bottom. Okay. So, all right. And then, so you decided, okay, I've been to Hopkins, I've been to DC. It's time to just go home for a little while. And so now you're back in Kansas with your sister. Tell me a little bit about your VA experience that you're with now and Vision.
So my experience with the VA has been a great one. I was able to, again, I'm very thankful for my program, and I don't know how many schools get this opportunity, but to actually create rotations. So while our school has access to several VAs, there wasn't one in Kansas City. So to do a rotation in Kansas back at home, I needed to set that up. And I was lucky enough to be able to find one with the Veterans Integrated Service Network. And for people who aren't familiar with that, ultimately, there's these networks that are kind of overseeing and in charge of working with several VA hospitals within that network. So for me, there's 7 hospitals within the Heartland network in the Midwest, anybody that's familiar with the Heart of America.
Yeah.
But so I was able to set up a rotation there with their pharmacoeconomics pharmacist, and ultimately in the role of like PBM world, as well as looking at a lot of their safety initiatives within all of the facilities. Right now, we know the opioid crisis has been a very strong and high point where pharmacists can play a large role. And so a lot of the programs that I was involved with working on projects for involved the opioid safety initiatives within the VA, as well as their PACT programs. These are patient line care teams that are pharmacy-led initiatives. So I was able to work a lot on projects revolving around that. And then the pharmacoeconomic side, I was able to mostly work on like drug cost analysis for certain drug classes within each of these facilities to identify different cost savings initiatives.
Okay, and then tell us just briefly what other APPE rotations you have as you're going to round out your career.
So right now I'm going to continue with this break and work on the process of applying for residencies. But once I get back for the spring semester in January, I've got 2 more rotations, and then I'll be done. But my next rotation is with geriatric pharmacy. It's ultimately one of the pharmacists from my school is a geriatric consultant pharmacist. So I'll be able to work with her. And what she does is she has several nursing homes settings and managed care type settings where she'll go in and do consultant work as far as looking in on certain patients' regimens and those sorts of pharmacy tasks.
Okay. And then the last one. Yeah.
Sorry. And my last one, I'll get to go home to my work home. So I work as a pharmacy intern at the Peninsula Regional Medical Center in Salisbury, Maryland, which is on the Eastern Shore. And I'm going to be doing a community rotation, but it's in the outpatient pharmacy at the hospital there.
Okay, awesome. All right, so now it's time to go to Orlando. And we're going to talk a little bit about ASHP, and I want to kind of hear what your thoughts were. So there were 3 residency showcase times. I think they were 3 hours each, and they were nice enough to spread the booths out pretty well. But it took. I was up there with some PGY1s, and we were watching, and it took about 11 minutes for the people to get in. So it was thousands of people. What was your strategy? And you don't have to name specific ones, but what was your strategy in getting the information that you needed in what is controlled chaos?
So what I will say is I definitely think if you're attending the mid-year meeting as a student and you're pursuing PGY1 or PGY2, it is important to do some research. While there may be some people out there that are able to go in and wing it, I think it's very important to have some sort of strategy. And ASHP does a great job of providing you with resources to do that. ASHP provided on the website what was like an Excel document where they listed every residency that was going to be present. So it was a list of just about 2,000 facilities that were going to be there, programs that were offering PGY1, PGY2 type residencies. The thing that I think helped the most was really just identifying your personal programs that you thought or that you think are going to be a fit for you. Doing your research ahead of time as far as, what are the mandatory rotations within the pharmacy residency? What's the size of the facility? Whether it be an outpatient clinic that you want to work with or whether it be an inpatient facility. And then pursuing those, really just kind of dialing down. It gives you an opportunity to explore if there's states or programs that you look at and you're like, well, I've heard about that. It gives you an opportunity to look at that and see if those are going to be a fit for you. But really what I would say is once you kind of identify those programs, use the resources they provide you. They provide you with a map where they're going to be sitting on the day of the showcase. Really kind of identify where it is, because when you get in there, I will admit, I did not go in right away any of the days. I waited 30 minutes. I don't think I'm a person who gets really overwhelmed or stressed out, but when you see that many students, we're all dressed up to the nine as best as we can, and we go in there, we've got the padfolios, we've got our business cards. We're very eager to meet with the residency directors and residents. I think it's important to just take a moment to figure yourself out. Don't compare yourself to other students. Don't compare your approach to other students because that will stress you out. There are going to be students who they've got it in an app, what they're going to do. They've got it written down, highlighted, color-coded. But
I've seen some of these secret treasure maps, yeah.
And, they look great and it's awesome. But if that's not your style or that doesn't work for you, be authentic to yourself ultimately. Because at this point in time, when you're at ASHP for mid-year, they tell you over and over again, these residency program directors are there for you to see, they're there to answer your questions. They're there to answer what you have. Some programs did a great job. They gave an overview because, maybe you stumbled upon or made a new connection while you were there that you weren't originally thinking about. But it's important that you recognize that do what you feel you're comfortable with. So find questions that you think you weren't able to, gather from the actual online information. Some of that information is kind of generic, but if there's something personal to you, research opportunities or specific types of, is there a teaching certificate and what that program specifically looks like, ask about those things and just get face-to-face. But also remember that it's not just during the residency showcase that you have opportunities to network. I'll tell you that I had countless moments where I would be in line for food or during my poster presentation where there would be, program directors or residents that come up to you. Those are opportunities as well to kind of engage. So don't always think that the residency showcase is the only place you're getting that opportunity at mid-year.
Yeah, no, that's great advice. I spent a lot of times, I went to 3 of the events afterwards, which would be after 6 o'clock. So I went to one where I'm a preceptor, the Maryland reception, and then also PTCB. And there they are, residency directors with no line. So it was just kind of, such a great insight that you have with that. Well, now, what does it look like now with what you're doing? So you've gone to the meeting. Now, forecast is your best friend for a couple more weeks. What's your kind of process for getting everything out there? It sounds like in creating these narratives for the national APPEs, you maybe had some experience in creating the types of documents you're going to need for this. But what's your process now?
So the process now, I think it's really, I've had a little under a week to kind of reflect, or about a week to reflect on my experience at ASHP mid-year. You go in there thinking, I've got somewhat of a list of the places I think I'm going to apply. But like I said, during like poster presentations and your meetings, you kind of develop conversations and network with maybe programs that you didn't even know you were interested in until you really got to know somebody from that program. And so there were a few like that popped up that I've been exploring and just kind of really locking in, is this somewhere I could see myself? And from that, I've been, uploading all the information into Forecast. So really tied down my CV, had a few more people edit that. I've been looking at making sure my letters of recommendation are, on top of the game to get those turned in on time. And then ultimately finishing up / starting some of the letters of intent.
Okay. Well, we do want to keep it maybe under an hour. I can't believe how quickly this time has gone. But yes. I just want to ask you 3 quick questions at the end here that maybe can help people understand on more of a day-to-day basis what it is you do that makes you successful. So on a day-to-day basis, what is it that you do to keep your work on track?
To be clear,
are you a list person, or are you,
okay.
What kind of management strategy do you have for time and tasks?
I very much am a list person. Anybody who really knows me knows I have a planner that is sometimes color-coded. I've kind of lost track of that as much as I used to be, but I really do like to plan out things. So this whole application process is a little overwhelming, and just kind of tying down a few tasks each day that you want to get done, and being, flexible to the fact that they might not happen or something might take longer, but just knowing that you are thoughtfully understanding that each of these has a set amount of time that you can give to it, and it needs to, start to get done. That's really important to me.
What's the best career advice you've ever given or received? And if Jim Brissett gave it to you, that's quite all right. He's a smart guy and was a leader within our class during my pharmacy time, and then has been a continued leader after. And UMES is definitely lucky to have him. But what's the best advice you've gotten or given career wise?
I think the best advice I've ever gotten career wise that I've received from several people. It's never stop looking for opportunities and just say yes. I know that sounds like you can't say yes to everything, of course, but at the same time, as a student, we're here to learn, and we're here to grow from the opportunities we're given. And so for me, I don't think there was really anything in pharmacy school I said no to, maybe a conflict of dates, but a lot of the experience I've been afforded and the opportunities that I've had have been because I just said yes. Maybe I didn't know what the organization was about. Maybe I didn't know what the conference was truly about, but getting to go and explore those opportunities, you can speak to those later. They provide you with so much more understanding of how the entire career of pharmacy works, rather than just within your own isolated bubble of this was what I planned. So just say yes to opportunities and explore.
And then the last question, what inspires you?
What inspires me? My mother inspires me. She's a lot of the reason I push and I drive for the things that I want to accomplish. She was an amazing woman. So every day I kind of hold that dear to me and continue to let her be my inspiration.
Well, Tola, thanks so much for being on the Pharmacy Leaders Podcast.
Thank you so much for having me. It's been great speaking with you.
Support for this episode comes from Goodnight Pharmacology, 350 brand and generic name drugs with classifications, a leading resource for students in the United States, United Kingdom, and Australia. Print, ebook, and audiobook available on Audible, iTunes, and Amazon.com. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.